Let's look at the crisis unfolding across rural America, where hundreds of small hospitals say they are at risk of closing, many of them pointing directly to Donald Trump's signature legislation, the One Big Beautiful Bill Act, as the tipping point that pushed already fragile facilities closer to collapse. New data shows more than 400 rural hospitals nationwide are operating at a loss or nearing it. These facilities have struggled for years with low patient volumes, high staffing costs, and an aging population, but administrators now say the situation changed dramatically after the bill took effect earlier this summer. Here's why. The law contains deep long-term cuts to federal Medicaid spending, a program that many rural hospitals rely on for a substantial portion of their revenue, and in some counties, half or more of the emergency room patients are covered by Medicaid. Under the One Big Beautiful Bill Act, federal reimbursement for those services were reduced, and states were forced to pick up more of the cost. But most states, especially in the Midwest and South, have not backfilled those cuts. Hospital executives say the math simply no longer works. For small facilities with only a handful of inpatient beds, even a modest drop in Medicaid reimbursement can mean the difference between staying open and shutting down. Analysts estimate some hospitals could lose up to 20% of their Medicaid-based funding over the next few years, and the bill does include a $50 billion rural health transformation fund, but experts warn that it's spread too thin, tied to specific pilot programs, and doesn't replace the steady, predictable revenue hospitals just lost. Several administrators who have applied for that funding say it might help modernize their operations, but it won't keep the lights on. We're already seeing the consequences. Glenn Medical Center in California closed last week after losing key federal designations tied to Medicaid payments. In Mississippi, 2 hospitals cut all inpatient services. And here in Nebraska, administrators warned that without immediate relief, maternity units and emergency rooms could shut down within months. Lawmakers from rural states are demanding changes, calling the One Big Beautiful Bill Act's Medicaid restructuring devastating and unsustainable. They say the bill was pushed through with the promise of transformation, but for many rural communities, it may instead mean losing their only local hospital. For millions of Americans, especially in isolated towns, a rural hospital isn't just a building. It's the difference between life and death, and right now, many communities are watching their lifeline disappear. If you enjoyed this video, don't stop here because we've got a whole playlist packed with context and updates just like this one. So click into the playlist, let it run while you work, cook, clean, or commute, and really get caught up. And make sure that you're following the Jazari Kual show so that you don't miss the next breakdown. Hit follow, tap subscribe, and stay plugged in.